I feel like I don't have any milk. I feel like I'm dry. I feel like there's nothing there for my baby. When will my milk come in? Hey everybody, welcome to my channel. My name is Brittany and you are watching A Dose of Nurse Babe. So thank you so much for joining me. Come on in, get cozy. We're just gonna pretty much dive right into this video. This is a topic that I absolutely love talking about. And it's lactation, breastfeeding. So this video is for my expecting mommies, my new mommies that are breastfeeding. Congratulations if you've had your baby already, and if you are preparing and you're out there trying to just educate yourself on what to expect, this video is for you. So the topic is going to be the most common breastfeeding questions that I get asked as a lactation consultant. I do work in the hospital full-time assisting new mommies and babies with breastfeeding. It's my dream job. If you want to hear more about how I became a lactation consultant, I'll probably make a video about that one day. So let me know if you want to know. My nurses out there, and not even nurses, anybody can actually become a lactation consultant. But if y'all want to know about that, just let me know down in the comments and I'll consider making a video. Back to the topic though, I'm going to be sharing the top questions that I hear from mommies on a regular basis at work. So hopefully this video will help you on your journey and in your preparation for breastfeeding. So before we get started, go ahead and like my video. And if you want to hear more content from me, definitely subscribe. I make videos on all things nursing, health and wellness, lifestyle, and pretty much anything that I feel can be uplifting. This channel is meant to be a sisterhood, a mutual exchange. So if y'all have questions, comments, concerns, or suggestions for future videos, let me know down in the comment sections below, and I will take those things into consideration for the future. So let's dive into it. I have my questions written down in my journal so we can stay on track. So yeah, let's dive right in. The number one question, and I mean the number one question that I get from new mommies is, when will my milk come in? I feel like I don't have any milk. I feel like I'm dry. I feel like there's nothing there for my baby. When will my milk come in? That is the number one question, and it's very concerning for parents because of course you want to make sure that your child is being nourished. But I want to right now go ahead and reassure you that you do have milk. Your body actually begins producing milk about halfway through your pregnancy. That first milk that your body produces is called colostrum. It's very thick, very sticky, and very nutrient dense, and it's so good for the baby. It's full of antibodies and good fats that are especially good for the baby's brain development. I mean, it's just, we call it mother's gold because of its color, but it really is, its value is like gold for your baby. So it's important that the baby receives this colostrum for you. Now, most moms don't feel a difference in their breasts until somewhere between day 3 and day 5. You should feel your breast starting to get fuller and feel heavier and warmer as your body is really starting to bump up the milk production. But after you have your baby, you have colostrum. As long as your baby is able to open her mouth or his mouth and latch on well onto your breast, your baby should be able to remove your colostrum. So this video again is for babies that are full term. There's no, medical issue or anything like that going on. Just in general, a baby that's born full term, healthy, as long as that baby is able to latch on well to your breast, that baby's able to remove the colostrum that is in there. And babies eat frequently. They're eating every 1 to 3 hours, sometimes sooner. We recommend that you feed your baby on demand. The more the baby feeds, the more milk your body will begin producing as the days go on. So to answer that first question, when will my milk come in? You already have it, boo. As soon as you deliver, you have colostrum. Now your body is going to begin producing more milk as the days go on, as long as the baby is latching on well. In general, that's the way it goes. Are there some exceptions to the rule? Of course, in life, there's always going to be exception. Maybe if you have some underlying hormonal issues that are undiagnosed, or if you've had breast surgery, that can affect your supply. Not always, but it can. If you had excessive blood loss during your delivery, which is not normal. Those that can affect your supply. But in general, most moms, as long as their babies are able to latch on well and feed often, it's going to encourage their body to begin producing more milk as the days go on. Question number 2. How long will it take for my nipples to toughen up? Okay, so this question is kind of like a double, 2 questions in one. They're asking how long does it take for the milk to toughen up, but what they really mean is how is breastfeeding going to be painful, and how long is it going to be painful for? When will it start feeling better? So to that I say, breast pain while feeding is common, but it's not normal. Ideally, you want the feeding to be comfortable. If the feeding is uncomfortable, that's usually a sign that the baby has a shallow latch, meaning the baby is only latching onto the nipple. Ideally, we like for the baby's mouth to be wide open and for baby to have a lot of your breast in his or her mouth, because that's going to help the feedings be more comfortable for you. And also, when the baby is latched on deeply, the baby can draw more milk from you. So it is a win-win situation. If you're having discomfort with the feedings, I would encourage you, if you're still in the hospital, to hit your call button, ask for help from your nurse, find out if your hospital has a lactation consultant available, if the nurse is not able to work with you through those issues, or you need a little extra assistance. If your hospital has a lactation consultant, find out if you can have that consultant visit you so that y'all can continue to work on developing a more comfortable latch. Ideally, this is what we want, because we want to make sure that you're comfortable. When you're comfortable, the feedings usually go better. And also, when the baby's latched on well, baby is able to receive more milk. So again, a win-win situation. Moving on to question number 3. How do I know that my baby is getting enough? This, is another great concern for parents. You want to know that baby is doing well. You want to know that baby is getting something from the breast, because you can't see how much the baby is taking as you would with a bottle. So there's a couple of things that you can look at. Number 1 are going to be baby's pees and poops. Some moms like to use an app to keep track. Some moms have a little logbook or something like that to keep track. Whatever works for you, I would encourage you to invest into some type of logbook or tracker so that you can keep track of all the feedings, the pees, and the poops. I actually have a feeding logbook, and it's right here so that y'all can see. You don't have to get mine, but I do think mine is pretty good. It has some tips in there for new mommies, and there's basically pages where you can see, where you can mark down how many times your baby's feeding, which side the baby fed on, and how often the baby is peeing and pooping. And my book actually comes in 2 colors. We have a pink and we have a blue. But apps work just the same. So you do what's best for you and your family to help keep yourself organized. So with that being said, you're going to look at baby's pees. You're going to look at baby's poops. All right. Peeing and pooping is a sign that baby is getting nutrition from you. Also, we are going to look at the latch. Your nurse or your lactation consultant should be teaching you what to look for as far as the latch. Babies, we like to see their mouths wide open and their lips kind of flanged outward, kind of like a fish, and them having a lot of breast in their mouth, not just sucking on the nipple like it's a straw. Like, we don't want to see that. We want to see mouth wide open, having lots of mom's breast in the mouth. Also, you'll notice when the baby is on the breast, you'll see a lot of movement up under baby's chin. You should see a rocking movement as though baby is pulling towards you. And when the babies are really going to town, sometimes you even see their little ears wiggling. Okay, so that's another way that you can be reassured that baby is feeding well, is a good latch where baby's mouth is open wide and baby has lots of your breasts in the mouth and the latch is comfortable. If the latch was uncomfortable, that's a sign maybe baby is a little shallow. And again, you would want to ask your nurse for help if you're having trouble getting the baby on deeper. Another thing that you can look at is how does your baby appear after feeding? After feedings, babies should seem relaxed, okay? The same way that you are after you eat a nice meal. Maybe you you want to loosen up your belt and you sit back. Same for babies. When babies start off feeding, they're usually a little tense. Their fists might be balled up. But as they become more satisfied, you'll see they relax, they fall asleep, their little hands might even, open up. So you look at the baby to see how he or she appears after feeding. She should seem relaxed, like she just had a full meal. And if you're having issues with babies still seeming really, really fussy after feedings, again, if you're in the hospital, refer to your nurse. If you're at home, talk to your pediatrician. Try to get in contact with IBCLC in your area to help you work on the breastfeeding. But the number one thing you want to really pay attention to are the baby's pees and poops. Moving on to question number 4. We're almost done. We have one more. When should I introduce a bottle to my baby? So with bottle feedings, ideally, you don't want to introduce bottles or pacifiers until the baby is very good at breastfeeding, which usually takes about 3 or 4 weeks. Introducing bottles and pacifiers can cause some confusion for the baby at the breast. Also, when the baby sucks on a pacifier, it sucks on the pacifier with its mouth closed, almost like baby sucking on a straw. Whereas on the breast, we want the baby's mouth wide open and we want baby to have a lot of breast in her mouth. So it can train the baby to have an improper suck. Ideally, and you have to do what's best for you and your sanity and your family. So this is not a rule, it's a recommendation. If you can avoid it, try to avoid the pacifiers and bottles until baby is really good at breastfeeding, which usually takes about 3 to 4 weeks. Now, on another note, when you begin to introduce formula to the baby, it can affect your milk supply negatively. And the reason why is because the body makes milk off of supply and demand. The more the baby sucks, the more your body should begin producing. If your baby is getting lots of formula, the baby's not going to be going to the breast as often. The babies tend to sleep longer in between feedings when they get formula. So your breast won't get as much stimulation. And this can cause your body to not produce as much as it's supposed to, or have your supply begin decreasing. So that is a risk. Again, I'm not the formula police. Again, you have to do what's best for you and your little family, and everybody's situation is different. Mental health is very important. So you have to take care of yourself and really nourish yourself, okay? So at the end of the day, if mommy's not good, everybody's falling apart. So I want you to always keep that, in the back of your mind, that you have to nourish yourself. But as a rule of thumb, in general, you want to avoid formula, bottles, pacifiers until the baby's really good at breastfeeding, usually about 3 weeks or so. Now, what if, this is question number 5, our last question, we're getting ready to wrap up. Is it okay if I just give a bottle at nighttime so that I can get some sleep? That's a very, that's a very good question. And a lot of times moms want dads to be included in the process, and dads want to feel helpful as well with feeding the baby. I would not encourage you to do this though, again, because it can affect your milk supply. The hormones that allow you to produce milk, they are even higher at night, and babies are nocturnal. Really, they tend to come awake at night, and they actually do a lot of feeding at night, especially as early newborns. So it's a part of the process of your milk supply coming in nice and full, and your milk supply staying once it has been established, that your baby is feeding frequently, even at nighttime. So if you do give bottles during the night, there is a chance that it could negatively affect your milk supply. Do people do it? Yes. Do some people seem to have no issues when they do that? Yes. But some people do. Some people, they skip a feed and they feel like their supply drops so low. So I just want you to be aware whenever you introduce a bottle or formula, if possible, pump your breast after. That way, at least your body still gets that stimulation that it needs to help maintain your milk supply, or help encourage your milk supply to come in nice and full. Okay? So I hope that you found this video helpful. If you liked it, give me a thumbs up. Go ahead and subscribe if you want to hear more from me. Please let me know down in the comments if there's other topics that you want me to dive into. And on my table, you see that I have my journals here. If you are an expecting mom and you want to get a feeding logbook, mine is available on Amazon. I'll put the link down in the description below. I also love to journal myself. I journal just on the regular, and this is one of the journals that I created for my mommies. It's called Growing Baby. It's just a simple blank line journal that you can journal in and document your experiences throughout your pregnancy. Till next time, I'm your girl Brittany. Be blessed.